This is a sisterhood no one wants to join.
I was diagnosed with breast cancer in October of 2008. I remember that it was my 49th birthday when I knew that I had to go for further testing. And remember sitting down and going, well, happy birthday, here we go.
It was never if I was going to have breast cancer, it was basically when I was going to get breast cancer.
And on April Fool's Day, 1987, I was told I had breast cancer.
It is a job no one prepares you for.
When Dr. Swiecki took the biopsy and stuff, I told him, I said, call me either way. I said, I don't want to come up here just to know everything's going to be okay, because you don't think the other way. So when he called me, I was working. I was out in the middle of the floor helping customers, and when he told me, I fell to the floor right then and there.
There were so many different reactions when I was first diagnosed. I can't tell you the first thing that came into my mind other than the fear. Then it was the anger. And then the determination to conquer this and make me a survivor.
Your breast cancer journey is so much more than just medical. It's personal too. I took time away from my kids when I was sleeping all the time. My 6-year-old, I mean, he somewhat understood because the cancer center gave us books to help read to him so he could understand it a little better. But I took time away from him because I couldn't go to school activities or read a book to him because Mom was so tired.
Are people going to look at me differently? Does this really make me a different person?
I wonder where this will take me. Concern.
And they said, well, I now have the big C. And my dear friend Fran, who lives in Minnesota, she hugged me big time, and her mother was lost to cancer, breast cancer as well. So she could relate to that.
And I prayed to God up above for strength. Please give me strength to handle this challenge you've given me. And 25 years of giving strength has helped from the good Lord upstairs and my family.
There is a story behind every woman whose life is changed by breast cancer.
My name is Felicia Van Lysel. I've been married for 10 years this past September. My husband and I have been together for 14 years. We have 2 little boys. One is 6, his name's Emmanuel, and one is 2, his name is Isaiah.
My name is Laurel, and I was diagnosed with breast cancer last spring in about April, end of April. And I've been married for 42 years with a husband. I have a dog.
Hi, my name is Mary Jo Monday. I live in Plover, Wisconsin, and I am married to a wonderful husband, John.
My name is Linda Zinda. I am married for over 40 years to a fabulous guy by the name of Mike.
To me, I'm a survivor. I lost my house, I had to surrender my car. I had double mastectomy and everything else like that, but it doesn't matter. Why? Because I'm here with my kids and my friends and my family, and I can enjoy the rest of my life with them.
1 in 8 women will begin her own breast cancer story this year. And with each new breast cancer diagnosis comes the decisions on which type of treatment to have, which doctor to see, and which hospital to receive treatment at. If you were a new breast cancer patient, wouldn't you like to know that a whole team of specialists would be involved in your care and would help to plan your best course? That someone special was going to be there to help guide you through the process? That is what the Breast Care Center at Ministry St. Michael's Hospital is all about. Behind each breast cancer patient is a full team of medical professionals helping her through her journey.
I'm Dr. Mark Wadina.
My name is Sabine Hale. My name is Kerrie Treutel.
Well, my name is Amanda Friese.
My name is Joanne Madigan. I'm Mary Busse.
Hi, I'm Judy Parfrey.
I'm Dr. Kit Swiecki.
Our initial conversation started with
the breast navigators and Dr. Swiecki. And from there, we established a partnership and now have been able to start a breast care center fund specifically for patients and their families served by the breast care program at Ministry St. Michael's.
Working with the breast care team is something that really catches a passion of mine, both on a personal level as a 13-year breast cancer survivor, and then also as a professional, a nursing professional who is very involved and committed to the care of women and trying to make things better.
I joined the breast care team. Actually, it's for reasons. A while back when I first started working in the clinic, I did have a patient that came through who was similar to my age. She had 2 young children, and she was diagnosed with breast cancer. When I went to schedule her for surgery, she came and sat in my room and looked me straight in my eye, and she said, "You cannot let me die. You can't let me be without my kids." And when she said that, it touched me because I had 2 small children. So it really had a huge impact on me and made me think, what can I do to ease the pain, fear of these women? And that's really was the biggest impact on why I wanted to be part of this team.
In October of last year, so just a year ago, we started with a small project that was just looking at one small piece of a breast cancer experience, that little piece of the biopsy. When a patient is told she needs to have a biopsy, everything kind of comes to a standstill, and you think, okay, well, how do I go about arranging that? Who do I have to call? When can I do this? When will I get results? It's like going through a whole new maze of information, and you don't know where to begin. So we implemented the nurse navigators.
As a patient navigator, I get to do a lot of things for the patients and families.
We also provide them with any kind of information they need for financial issues, refer them to community resources such as support groups, and really just be that advocate for the patient.
Every meeting we had, we said, picture the patient sitting in the middle of this table, and let's build the process around that concept of that patient.
In breast imaging, we have an opportunity to meet the patient, explain to the patient what's happening with their imaging workup, and help guide them through what they're going through. And it puts a face to the name of what we do.
The treatment that they receive and being in a timely manner is so important because of that diagnosis and the anxiety and fears that go along with that, along with their family members that are with them. They're just as important as that patient. They're just as nervous, maybe more so, than the patient themselves.
With breast cancer, this is a lifelong disease. This is something that that woman and her family will live with for the rest of her life. Maybe not with cancer, but with that disease process in the back of her mind. She'll always identify herself as a breast cancer survivor, and being part of that process is a very special piece of general surgery.
So what's the next step for this program? The breast care team, along with St. Michael's Foundation, has a vision for women in central Wisconsin. The vision is to develop a complete breast care center at Ministry St. Michael's Hospital, where a nationally recognized continuum of breast health screening, diagnostic services, and treatment will be available to every woman in our community. Together with the support of individuals, organizations, and businesses in central Wisconsin, our hope is to open the new breast care center at Ministry St. Michael's Hospital in the year 2014.
The Foundation's involvement with the Breast Care Center, having a fund available at the Foundation, hopefully will reach out to women in our community who are not getting a mammogram or an annual screening, so that we're able to touch those that perhaps can't afford that service, so that we can increase awareness and be advocates for annual screenings, but also reach those folks in hopes of early detection.
If you have a breast center in your community, and you can educate the women not only to have the screening, but then give them already an idea of that is not the end of the line. If you have a malignant diagnosis, we have solutions for you. That is the most important step. We have to take the fear factor out of this.
Breast cancer, especially that first year, you have so many appointments and so many different disciplines that if you are getting treated even a half an hour, 45 minutes away, that is a big toll on your life, bigger than it already is with just undergoing the treatment that you need.
And being able to have everything right here where they don't have to run from center to center and spend a lot of time on the road is very important.
It's so hard to find someone who doesn't know someone who has been affected by breast cancer.
Nobody in my family, fortunately. Here in town, though, I have 4 daughters, a wife, and my mother's still here in town. And so the idea that breast cancer touches 1 in 8 women in their lifetime really hits home to me.
It all exists in St. Michael's Hospital already.
We have great surgeons, great radiologists, great pathologists. Everybody on that team is really working for the patient, and if I were a patient, that's where I would want to go.
Together, we can join in the fight against breast cancer right here in our community. For more information in joining the fight, contact St. Michael's Foundation.